Welcome to the Anesthesiology Annual Meeting. We're here in Orlando exploring the human side of medicine, putting patients first.
I mean, you know, we are given the privilege of touch in this context. It's part of our fiduciary responsibility to the patient. You're not allowed to just grab someone otherwise. I know there's a lot of confusion about this in the highest circles in this country.
Dr. Abraham Verghese echoed the theme of the meeting, drawing in the power of the human hand. He reminded all of us to not lose focus of the patient, even as technology evolves and more offices rely on it.
And I always felt that if the patient gave up the quest for the magic blood test, the magic doctor, the magic this, and just began a partnership with me towards wellness, it was because something had transpired in that exam.
One big takeaway: evaluate your patient relationship. Are you treating your patient like a human patient or an eye patient?
Even though we have that short contact with the patient, it's so important, in terms of easing, their stress level and all that, trying to meet their expectations. I think, they're so vulnerable at that time, and they're looking for that confidence from us.
Technology plays a key for all of us. While we don't want to lose touch with our patients, tech can help us better ourselves. For example, artificial intelligence and machine learning are key as data in the perioperative setting grows. This approach can help better predict post-induction hypotension.
They show us how this can apply in our daily practice, and now I'm very excited to start to find some to apply this in my daily basis clinician.
I think artificial intelligence and machine learning is going to be part of the future of our practice, and so it's important that we start talking about this and understanding what goes into machine learning.
The role of anesthesiologists has evolved. We're being relied upon for updates on regional anesthesia options, which data shows, while underutilized, it is more effective than general anesthesia. Still, more research is needed.
I thought it was really great. It was very informative. He talked a lot about how anesthesiologists have been evolving our care for our patients and improving outcomes long-term with what we do in the OR, which I thought was really, really interesting. So I learned a lot about neuraxial anesthesia, and especially for joint patients, total knees, and how that's improving outcomes.
As a resident, it's emphasized in our training, and we're given a lot of experience with regional anesthesia. So to see some of the data behind how it's improving the care for certainly elderly patients is good. There's still a lot of research that needs to be done, but it's exciting, it's cutting edge, and that's sort of a reflection of the whole event here.
The opioid epidemic isn't something that can be ignored, and it's one that's very important to us here at the Anesthesiology Annual Meeting. Of high interest, the FDA's current analgesic REMS education blueprint for healthcare providers involved in the treatment and monitoring of patients with pain. The new interactive session gave attendees a good understanding of pain management strategies and warning signs of opioid mismanagement.
For me, it's a little bit different because I'm from Brazil, and we are not having that crisis with opioid yet. But I think it was good to learn that there are a few alternatives for treating pain with our patients.
As parts of the country have legalized use of cannabis for medical purposes, it's important that we know the pros and cons of cannabinoids.
It's always been a struggle for me, being a pediatric pain physician who also knows all about the opioids and sort of the things that come with it, as well as sort of this new emerging interest, which is mainly driven by parents and families. So I want to be able to put together good evidence for them.
And sometimes I feel that patients come in more informed about this topic than their providers are. So it's really important to stay on top of this.
Anesthesiologists are constantly under pressure and stress. When you start to notice suicide risk factors in your colleagues, there are things you can do to help.
There's a great deal of concern about the welfare, certainly of our trainees, our residents, but also our colleagues. Issues of burnout are big at the moment, and we need to be looking out for each other. So it's very relevant.
I've expanded my practice with a psychiatry team where we actually administer IV ketamine to help treat refractory depression. So it's a newer field that anesthesiologists are getting involved with, and so I thought this session actually provided a lot of background information about the underlying pathology behind suicide.
If you or a colleague needs someone to talk to, you can call the National Suicide Prevention Lifeline at 1-800-273-TALK or text the crisis text line by texting HOME to 741-741. Are you striving for trust and respect from your patients? It's essential when it comes to their safety. As part of the Ellison C. Pierce Lecture, Dr. Jeffrey Cooper emphasized the importance of relationships when it comes to patient care.
It's really important for us to communicate clearly. That happens more easily if you've established a relationship with your colleagues. It's important to have a face-to-face or a phone call rather than have someone else, a third party, call and cancel a case if that is what needs to be discussed.
The common theme in every session is research. It was recognized and celebrated on Saturday. Award winners presented a sampling of their accomplishments at the celebration of research.
These are individuals who have contributed greatly and will continue to contribute greatly to creating new knowledge. And it's that new knowledge which helps propel the specialty forward, helps improve the way that we take care of patients, and helps contribute to the science of the specialty of anesthesiology.
Special recognition for the best abstracts. Anesthesiology is sponsoring the 2 best abstract sessions chosen by a panel of editors. One was chosen from basic science and the other, clinical science. There are still 3 full days of education to explore. Plus, explore the best products and services supporting the specialty on the exhibit hall floor. For now, we leave you with a look back at this year's grand opening reception. For ASA TV, I'm Sarah Penko.